Hello everyone, my name is Jenci Hawthorne and I'm a fourth year medical student at the University of Louisville. I'm going to take a few minutes to talk about the hot topic on all of our minds, COVID-19 or coronavirus. I'm going to run through some of the symptoms of COVID-19. I'm going to talk about when to quarantine and how to protect yourself, what to do about housing and living with multiple people, including people who have COVID-19, what tests are available, and what to do with those test results, and what they mean, and then what you should expect from your doctor for follow-up. This video was made September 10th, 2020, so that is when this information was most up to date. So let's dive into it. So some of the symptoms of COVID-19 are wide-ranging. You could have mild symptoms to severe illness. Symptoms appear 2 to 14 days after exposure to the virus, and people are infectious for 2 days prior to having symptoms. So some of the symptoms of COVID-19 are the following. You can have fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, new loss of smell or taste, sore throat, congestion or runny nose, nausea and vomiting, diarrhea. There can also be skin changes. You can have what's called COVID toes or different kinds of rashes that appear all over your body. So there's a lot of other symptoms, but those are some of the main symptoms that we have found with COVID-19. Some of the emergency signs when you know you should seek care immediately or go to the emergency room here in Louisville is when you have trouble breathing, persistent pain or pressure in your chest, new confusion, inability to wake or stay awake, you have bluish lips or face, and if you have any of these symptoms, you want to call 911 or call ahead to your local emergency facility to tell them that you're on your way and you know someone or are someone with COVID-19. Okay, so those are some of the symptoms you can have with COVID. When should you quarantine and how you should protect yourself? So one of the most important things to know about how to protect yourself is how you can get coronavirus or COVID-19. So right now, there's no vaccine to prevent COVID-19 at this moment. And the best way to prevent illness is to avoid being exposed to the virus. So there's 3 ways that COVID spreads. One is called fomites. So this is on surfaces, and this is why we clean and disinfect all the different surfaces that we could touch. It can also be spread via droplets. So that's from person to person. It could also, and so that's why we have social distancing or physical distancing of further than 6 feet apart from others. And these respiratory droplets can infect people when a person coughs, sneezes, or talks. So that's why we also have masks. And then the droplets can land in the nose and mouth of people and then get inhaled into the lungs, which can then cause COVID infection. And something that's important is that COVID can be spread by asymptomatic people. The third way that COVID-19 can be spread is via aerosols. So these are really tiny particles that are under 5 microns that float in the air for hours. So this is why you also want to be really careful and why wearing a mask is really important. So in addition to masks, and avoid being around people who have COVID or potentially have been exposed to COVID, is to wash your hands often. So you need to wash your hands with soap and water for at least 20 seconds, especially after you've been in a public place, blowing your nose, coughing, or sneezing. It's especially important to wash your hands before eating or preparing food, before touching your face, after using the restroom, after leaving a public place, after blowing your nose, coughing, or sneezing, after handling your mask, after changing a diaper, after caring for someone sick, and after touching animals or pets. So if soap or water isn't readily available, you can also use hand sanitizer, but it's important that it contains at least 60% alcohol, and you should cover all surfaces of your hands and rub them together until they feel dry. This is why it's also important to make sure you avoid touching your eyes, nose, or mouth, especially with unwashed hands. So those are some of the ways that you can protect yourself. Something else that's really important is who needs to quarantine. We keep hearing about all this quarantining, and so it's important to know when to do that. So So, people who have been in close contact with someone who has COVID-19, especially people who have COVID-19 within the past 3 months. People who have tested positive for COVID-19 do not need to quarantine or get tested again for up to 3 months as long as they do not develop symptoms again. People who developed symptoms within 3 months of their first bout of COVID-19 may need to be tested again if there is no other cause identified for their symptoms. What counts as close contact? It counts when you're within 6 feet of someone who has COVID-19 for a total of 15 minutes or more. You provided care at home to someone who is sick with COVID-19. You had direct physical contact with the person, aka hugged or kissed them. You shared eating or drinking utensils. They sneezed, coughed, or somehow got respiratory droplets on you. And so steps to take for quarantining. Stay home and monitor your health. Stay home for those 14 days until your last contact with someone who had COVID-19. It's also important to look for a fever. So a fever counts as 100.4 degrees Fahrenheit. Look for cough, shortness of breath, or other symptoms of COVID-19. If possible, stay away from others, especially people who are at high risk of getting very sick from COVID-19. So I mentioned that I was going to talk about housing. So it's important when you're inside your house to avoid close contact with people who are sick. Specifically, if you're living with a COVID-19 patient, it's important for them to have a separate room and ideally with their own bathroom. The health department is putting some people in alternative housing arrangements during their confinement time to try to help and decrease the spread. Outside of your house, keeping a 6 feet distance between yourself and people who don't live in your household is very important. And that's about 2 arms lengths is how far you want to keep from people. Okay, so I said I was going to talk about the different types of testing. So first, there's a viral test and there's an antibody test. So the viral test is for current infection, and that is collected via nasal swab or saliva sample. A positive PCR test, or the viral test, depends on 2 things: the skill of the person performing the test and the amount of virus the patient is producing who has COVID. So who should get tested? Anyone who has symptoms. That includes all the symptoms I listed before, including fever, cough, shortness of breath, any strange rashes, not vomiting, or diarrhea. And you should contact your healthcare provider about scheduling a test. Certain people who do not have symptoms or who are asymptomatic who are also people who should get tested if they have the following. So if they're asymptomatic and recently had exposure to someone with COVID-19, you should also get tested. And if you're asymptomatic in a special setting with someone who has been exposed to COVID-19 for early identification of the virus. Individuals who have tested positive before and are now asymptomatic in order to determine if the infection is actually gone. Another reason would be for public health surveillance to see the amount of asymptomatic carriers in the community. So those are examples of people who would be asymptomatic and need to get a test. So for all testing, in all testing sites, it's important to call ahead or pre-register. So I wanted to say specifically today, September 19th, you can get registered at Redeemer Lutheran Church at 3640 River Park Drive, zip code 40211 in Louisville, Kentucky. And that testing is going from 9 a.m. to 2:45 p.m. via drive-through. So you won't have any contact with any of the testing participants. And we're also taking people who aren't pre-registered. So we'd love to have you come and get tested. In addition, there's a whole host of other places you can get tested via the health department, and it's on their website. Okay, so if you test positive for COVID-19 with a viral test, there are several steps that you need to take in order to make sure that you don't affect a loved one that you've lived with. And that includes the same things that I've mentioned before, such as having a separate room and ideally having a separate bathroom as anyone else in your family to prevent them from getting sick. If you test negative for COVID, you probably were not infected at the time that the sample was collected. However, that doesn't mean that you will not get sick. The test results only mean that you did not have COVID-19 at the time of the test. You might test negative if the sample was collected early in your infection and test positive later during your illness. You could also be exposed to COVID-19 after the tests and get infected then. This means that you could still spread the virus. If you develop symptoms later, you might need another test to determine if you're infected with the virus that causes COVID-19. Okay, so that's all about the viral test for COVID-19. The other test you can get is to look for a past infection via antibody testing. So antibody testing for COVID-19 is available through healthcare providers and laboratories, and you have to check to see if you could get one. A positive test says that you might have antibodies from an infection with virus that caused COVID-19. However, there is a chance that a positive result means that you have antibodies from an infection with a virus from the same family of virus as COVID-19, also called coronaviruses. And coronavirus is the same virus, is from the same family of viruses as the common cold. So that could be an example of why you might have a positive antibody test. This means that you should still protect yourself and others since you could get infected with the virus again. If you test negative for the antibody tests, you might not have ever had COVID-19, and you should talk to your healthcare provider about your test results and the type of test you took to understand what these results mean for you. What you should expect from your doctor and follow-up. So, information about COVID-19 and quarantine is constantly being updated and changed. This is why it's important to obtain accurate and up-to-date information from your physician and/or local health department, which in our case would be the Louisville Metro Health Department, for frequent questions that you may have regarding COVID-19. Telehealth visits with your physician is also a great way to ask questions and clarify when it's best to go to the doctor, hospital, or for you to quarantine. So, most recent updates from the CDC about discontinuing or stopping home isolation for a person with COVID-19 involves ending isolation or precautions for a person that you may have. Specifically, researchers have reported that people with mild to moderate COVID-19 symptoms remain infectious for no longer than 10 days after their symptoms began. And those with more severe illness or those who are severely immunocompromised remain infectious for longer than 20 days after their symptoms began. Therefore, the CDC has updated the recommendations for discontinuing home isolation as follows. First, persons with COVID-19 who have symptoms and were directed to care for themselves at home may discontinue isolation after the following conditions. At least 10 days have passed since symptom onset, and at least 24 hours have passed since resolution of fever, without the use of fever-reducing medications, or if all other symptoms have improved. So, I want to thank you again for taking the time to listen. And remember that the Center for Disease and Control and the Louisville Health Department are your best resources about COVID-19. There is also a slide during the commercials that we have through this program with doctors' offices through the University of Louisville or UofL Health that you can call to schedule an appointment or see an emergency room near you for questions. And the sources that I used for this presentation were the CDC and the Louisville Health Department. I hope you have a great day and continue to stay safe.